So as part of our Talk Care campaign, we undertook a pop-up in Princess Hay in Exeter town centre. And a question that arose was, who pays for care and how can I access benefits?
Right, well, paying for care is sometimes quite contentious, isn't it? Because I think there are a lot of people, particularly older people sometimes, who think they paid in all their lives. Should they be paying again? Or they come to a charity maybe, and then the charity has some services that are charged for, and some people think, well, hang on, how does that work? The reality is that we live in a social care market. That's what it is. So if you're receiving help from social services, from the statutory services, then they would undertake a financial assessment based on your savings and based on your income. So if you have savings of more than 23,250, not including your home, then you wouldn't be eligible for financial support from the local authority to pay for your care. If you have savings of less than 14,250, then you would be eligible, depending on your income when they do the financial assessment. And anywhere in between that 14,250 and 23,250, there's a sliding scale. So there are charges. There are things that can help with those charges, getting onto the benefit side, things like attendance allowance, and they can make a real difference for people. And it's not even around you actually having the care, it's whether you need that care. And that's paid at two rates, so there's a daytime rate and a higher nighttime rate. And so if you're in receipt of that, then that gives you more opportunity to go out there and buy some of the things you might need. From social services, the funding might be direct funding. They simply commission a service for you and a provider provides it, and then you get if you're eligible to pay or pay a contribution towards it, you'll get a bill from social services. Or they may offer you something called a direct payment, where you can hold the money and then you've got free choice as to how you spend it to meet your care needs. But it is really important, I think, for people to think about their benefit position and also the things that come along with it in terms of reduction in council tax and that kind of thing. And again, we have, in Exeter, we have something like 15 volunteers supported by a paid manager who help people with benefit claims. We have volunteers who can go out and see people in their own homes to help them with attendance allowance forms. And that can really make the difference, I think, in terms of making what is a very complicated procedure, because of the form's big, into something that's manageable and easy. And so we can support people in doing that. So my advice to people is, don't put it off. If you think you may be eligible, and of course a lot of older people are quite proud and don't like to claim benefits sometimes, but this is something that is your right. You paid in for it. So if you think you're eligible, then contact your local Age UK and then they can take you through it and see whether that in fact is the case.